Meet Maurice, a community health worker in Homa Bay. He loves working closely with the community. Over the past few weeks, there has been a serious increase in the number of community members getting sick with flu like symptoms. Some have been worse than others, and a few people have had to be rushed to hospital outside of their village because they were unable to breathe. The patients rushed to hospital were diagnosed with COVID. Many members of his community thought that COVID was over. Since it is back in his community, he is prepared to help his community understand how to get long term protection from the virus. COVID is still here. Even though the mask mandate has been dropped, COVID is still prevalent around the world. Taking precautions can help you avoid COVID, but the best protection is vaccination. Getting vaccinated helps you and your community stay safe from COVID. Welcome to this unit on what is COVID. By the end of this session, you will be able to explain COVID-19 to others, explain typical symptoms, explain more severe symptoms, and explain different ways to avoid getting COVID-19 or spreading it when you are sick. Coronavirus disease, also known as COVID-19, is a disease caused by a virus. It is very contagious and spreads quickly. COVID-19 causes respiratory symptoms similar to a cold or flu or pneumonia. COVID-19 may attack more than your lungs and respiratory system. Other parts of your body may also be affected by the disease. Most people with COVID-19 have mild symptoms, but some people become severely ill. The 3 C's for transmitting COVID-19 are a useful way to think about it. They describe settings where transmissions of the COVID-19 virus spreads more easily, and they include number 1, crowded places, number 2, close contact settings, especially where people have conversations very near each other, and lastly, confined and enclosed spaces with poor ventilation. The time from exposure to COVID-19 to the moment when symptoms begin is, on average, 5 to 6 days and can range from 1 to 14 days. This is why people who have been exposed to the virus are advised to remain at home and stay away from others in order to prevent the spread of the virus. What are COVID-19 symptoms? Most common symptoms are fever, chills, and a sore throat. The symptoms that are less common and may affect some patients include muscle aches, severe fatigue or tiredness, runny or blocked nose or sneezing, headaches and dizziness, sore eyes, persistent cough, tight chest or chest pain, shortness of breath, numbness or tingling, nausea, vomiting, abdominal pain or belly ache or diarrhea, appetite loss, loss or change of sense of taste or smell, and difficulty sleeping. There are times when COVID-19 can be very serious. Watch for these symptoms. Symptoms that require immediate medical attention include difficulty in breathing, especially at rest, or unable to speak in sentence, confusion, drowsiness, or loss of consciousness, persistent pain or pressure in the chest, skin being cold or clammy or turning pale or a bluish color, and loss of speech or movement. If you have COVID symptoms, remember to, if you are unwell, stay at home. Wear a mask when interacting with others in or outside of your household or sharing space with others. If you have shortness of breath or pain or pressure in the chest, seek medical attention at a health facility immediately. Get tested for COVID-19, regardless of your vaccination status, and especially if you are at high risk for severe illness. Lastly, practice protective and preventive measures. Wear a mask, avoid crowded areas, practice hand hygiene, and respiratory etiquette. Is there a way to protect yourself even more from COVID-19? Getting vaccinated is one of the most important things you can do to protect yourself against COVID-19, help end the pandemic, and stop new variants emerging. In the next session, we will learn about vaccinations, learn about COVID-19 vaccinations, and the types of vaccinations that are available in Kenya. And lastly, we will look at the side effects of the COVID vaccine. Maurice knows that the best way to ensure his community stays healthy is to get everyone who is eligible to get vaccinated.